Good morning. I was hoping not to be here the next day after yesterday, and Dr. Whalen and I were just discussing that on the way in. But today's 244 days, 35 weeks since we had our first case of COVID-19, and now we're at 4,016 positive cases of the coronavirus in Albany County. 1,437 people under mandatory quarantine, and we have a net increase today of 68. So 68 positive cases overnight. That's over 400 cases since last Monday. So when Dr. Whalen and I have talked in the past, and we were looking at the trend of being January, February, we're here now. I don't know if it's contributed to Halloween. Not sure. But we're seeing a spike in numbers that we haven't seen since this first hit. The other reality is that we have kids shortly coming back from school that we have to be concerned about. We have Thanksgiving around the corner that we have to be concerned about, and we have COVID-19 fatigue that we have to be worried about. And said it yesterday, said it again today. I'm tired. I know Dr. Whalen's tired. I know our staff's tired. Everyone's tired. But we have to stand our ground and continue to know this virus is there, and we have to be prepared and keep our guard up by wearing our mask properly, by coughing into our arm and doing everything socially distancing. I know it's getting tougher. Of the positive cases for today, 32 had close contact to positive cases, 5 healthcare workers, 2 people that reported traveling out of state, and then the bigger number, 29, don't have a clear source of infection. We know it goes back to some might not, maybe a small percentage out of that, but out of that 29, there's people that they're just not telling us. Again, you're not protecting somebody. We're not going to lock them up. But if you want us to stop this spread and you don't want to shut businesses down again and you want to get back to somewhat of a new norm of the world we're in, we need your help. And, again, that's why the Governor Cuomo came out with the red zone, the yellow zone, the orange zone to break it up. So we're trying not to shut down. But we can't stop that cluster if you don't inform us properly where it's at. So, again, please, people, do the right thing and just be honest with us. 17,800 people have now completed quarantine. 3,649 tested positive for the virus. 36 recovered since yesterday. As you know, we had 46 kids from 4 different Albany schools that were on buses, and one was positive out of that, and the other ones are under just quarantine. They're just self-quarantine, the other kids that were involved. These are issues that we're going to continue to happen as we go forward. That was the reason why I pointed out what happened in the city of Cohoes with the basketball tournament going on there. That was on Facebook, Instagram. It's down now. We are looking into it, but I talked to the county legislator from the city of Cohoes, Bill Rickard. He's on top of it, and it happened. I will say to anyone that was at an event like that, was at that event, was at other events, please go get tested. Go get tested. We put it out there. There's places you can go and get it done free. You Albany, Whitney, Young. If you don't, we'll pay for it. Because I did see the video, and it is off. It is down now. But I would say hardly anyone had masks on. You would have thought it was a game being played a year ago. It's here, people. Please help us get through this. So the other big issue that we're having is now our hospitalization rate. 36 people currently hospitalized, 4 new hospitalizations overnight, with a hospitalization rate of 0.89% of those have tested positive. Yesterday it was at 0.18%. 5 patients are currently in the ICU, and yesterday the number was 4. So we're starting to see more people in the ICU, more people in the hospital. Look what's going on in Midwest, what's going down in Florida, south of us. It's getting bad again, and we need your help to get through this. Our numbers are still going up in every category, which we keep pointing to. We again need to continue to take this situation serious to get through it. We're going to take a look at the dashboard because we haven't done it in a while, and it shows you why we haven't had to do it in a while. Numbers are getting good, but one of the things I want to point out First, on the age group that we've tested and that continue to lead in positive cases is the number of kids in the age group 20 to 29-year-old, which I identified early on when I was talking about the 20 to 29-year-old. That number was getting above the 50 to 59-year-old, and in other places in the country, it was the 50 to 59-year-old that was actually seeing a more positive return than the 20 to 29. So a month ago, those who have tested in that group had 807 positive cases. And as you can see now, the slide I got up, the 50 to 59-year-old had 435 positive cases a month ago. As of today, the 20 to 29-year-olds have 1,054 positive, and the 50 to 59-year-olds have 553. So, and we still got a ways to go. So I'm going to go to the dashboard to look at a couple things that I was just talking about. But again, and I'll let, whoop. Where you got me here, Mary? Oh, Mary. Yeah, down. So, again, you look at this draft as we're continuing to go up from April 2020 to November 2020, and then our cases, which really just shows our positive cases. And the last time our biggest peak was April the 26th, that we had 74 cases. And then you come over here and you see the same thing that we, I'm having good luck with the tapping today, but we were up to about 70. And you can see as the numbers continue to go up, that's what we have to be alarmed about. And in the zip codes that we've talked about, 12203 and the other thing, but this is what I continue to watch and have watched is the 20 to 29-year-olds. Again, that number is going up more than the 50 to 59-year-olds. And I know Dr. Whelan will get into the drafts and the numbers breakdown. But, I just want to point out that we have tested. Total persons tested to date has been 202,984, and positive results are a little bit over 2%. Persons tested, today so far is 976. So these are things as we continue to watch that go up. It's science. It's pure facts. So the only way we're going to get through this is by everyone working together to make sure at the end of the day that we're in this together. But Dr. Whelan.
Good morning. Our numbers are going in the wrong direction, and I'm very concerned. If you look at this, this total positive cases that we have, and people are wondering, is there a second wave? We're as high as we were in late April when we hit our peak. And what happened at that stage? We were shutting down. We were shutting down. No one was leaving their house. I would come to the health department and be able to drive here in about 5 minutes because there was nobody on the road. And now we have kids back in school. We have people back in their places of work. So what am I concerned about? This number is going to go up unless people change their behavior, unless people are very vigilant with what they do. We are going to see these numbers go up. And what happens when those numbers go up? Our hospitals start to fill up, and we start to hit surge capacity. This is also happening as we enter flu season. So I'm doubly concerned. This is not where we want to be. This is where we hoped we wouldn't get, and we're there, and it could get worse. And if behaviors don't change, it will get worse. So that's the most important thing that I want to get across to the media, because it's very important that we share that information with the public. Our zip codes, some reason, aren't coming up. I know the demographics are important in the age, and we have seen SUNY decide to go virtual yesterday because of the number of samples that they have seen test presumptive positive. We're waiting for confirmation on that to get you accurate numbers. A lot of tests have been performed. We see female affected more than male at this point. And we see Black or African American communities, 20.3%, which again is higher than the demographic population in the county. So it does continue to disproportionately affect communities of color, which is also a concern. When we look at that and drill down the numbers in terms of hospitalizations, again, with Black or African American residents being 11.4% of our population, they represent 24% of ever hospitalized and 28% in the ICU. But we continue to see hospitalization rates rise, and this is a concern. There's a couple of things that I've seen and that our department is seeing that's disturbing. Children that are excluded from school with fever and respiratory illness are recommended to get testing. If they have COVID and it is not diagnosed, we cannot quarantine individuals that may be exposed and may become infected. We know back from the spring, and data is probably emerging to give us new numbers, that for every case of COVID, they infect 2 to 3 people. We might see even more than that of late. But if your child has those symptoms and does not get a diagnosis, it is simply not enough to keep that child home for 10 days. You must test, and you must share contact information. This is the only way that we can stop the spread of COVID. This is what we've been saying from day one, and I think people aren't taking this seriously. And this is why our numbers continue to rise. And I'm very concerned what the next couple of weeks will bring. We want to be able to, have kids at school. People want to be in their places of work. They need to continue to wear masks. And I'm looking out at a group of people, and I see people without proper wearing masks. Put your mask on the right way. Cover your nose and your mouth. Otherwise, you're not protecting yourself. You're not protecting other people. Please share this information, parents, with your children. Please share it with your friends. We are in a very serious position right now in Albany County. And we could get worse if people don't change their behavior. We don't want to resort to wide-scale shutdowns. I am fully aware of the psychological and economic and other implications and the toll that this pandemic has taken on this county, on this state, and on this country. But the responsibility is to each one of us individually to do what we need to do to protect ourselves, to protect our families, and to protect our community. It's not a lot to ask, but it can make a big difference. So please, wear your mask, cover your nose, cover your mouth. Do not go to large gatherings unless you have to. Do not go to parties. Do not allow your children to go to parties. Wash your hands. Ask yourself every time you go out, do you need to go out? And how will you protect yourself while you're out? Wash your hands, keep your distance, keep your mask on. These behaviors are more important now than they have been. And you know what? We could have stopped this in the beginning if people listened to this advice. Viruses need hosts. They need somebody to infect. If you stop the chain of transmission, the virus has nowhere to go. This country has done a poor job of stopping this transmission. And our numbers across the country are a huge concern. It is really essential that people remember the individual mandate to just do the right thing and protect your family, your friends, your children, and your community. Thanks.
Thank you, Liza, and for that message. And I don't know how better we can put it. We need your help. We need to be in this together, and we'll get through it. And, the only way we're going to get through it is by people just following them simple steps of the mask and coughing into your arm, cleaning your hands, and staying 6 feet apart. I know we keep saying it, but we need to keep saying it because as these numbers continue to go up in hospitalization, I don't want to see anyone lose a loved one through this, or watch someone get sick in recovery and come back out of it, because it takes its toll on the people that were in the hospital that come out. They got a long road ahead of them. I'm watching my brother-in-law who's finally out of the hospital but struggling, and different person than he was before he went in. And, again, I don't want to see anyone go through it, but we can get through it working together. And I do, talking about partnerships and moving forward, I can't thank the president of UAlbany, Javier Rodriguez, for his partnership, for his friendship, for his leadership at UAlbany, everything he's doing up there. We had the issue with the students in the beginning, and they got it right. Now all these kids are going home to their parents, and hopefully what they learned here at the University of UAlbany go back and continue that good practice and protocols to stop the spread in their own communities when they go back. So thank you to the president and everyone out there for doing your job. So can't thank you enough. Dr. Whalen, thank you for everything. Just remember, please, cough and sneeze into your arm, clean your hands, and continue to, we'll get through this if we work together. So, again, if you don't have insurance, I want to make this clear. I know people are getting charged. We're looking into too. Some people are getting charged now on their insurance for PPE because of extra protocols the doctors or offices have to take. So please, we'll pay for it. If you can't afford it, you can go to Whitney Young. We'll pay for it, or University of UAlbany is free. That governor set up, and they've never taken an insurance card or any sorts since you've gone through there. So please go through there, get tested. You can call the University at Albany and schedule an appointment by calling 1-888-364-3065, and as always, the Whitney Young testing at 518-465-4771, and the other testing sites that we continue to put out there: CVS, Walgreens, Rite Aid, Albany Med, Urgent Care, Priority 1 Urgent Care, Central Med Urgent Care, and there's a full list at albanycounty.com. Please go to it. It's convenient, and if you have any signs or symptoms, please go and get tested. If you've been exposed to anyone, go get tested. Dr. Whalen said it perfectly. If your kid has a fever, sniffles, go get tested so we can do our job, so we can stop the spread, and we can come try to get back to some type of normalcy. Mental health is always available 7 days a week from 8 a.m. to 5 p.m., 518-269-6634, our 24-hour sexual assault hotline, 518-447-7716, the 211, and also the 1-888-364-3065, New York State hotline. Please check on a buddy, check on your neighbor, reach out to people, see if they're doing okay. And if you know people are struggling with addiction, reach out to them and just make sure they're doing okay. And be that friend, and they'll appreciate it more so than ever. And again, continue to do the right thing. We'll get through this.